Hello, my name is Paige Bateman, and this is my health assessment on the head, eyes, ears, nose, and throat. This is my husband Blake. He's my patient today. So the first thing we're going to do is look at his head. We're going to go through his hair to see if there's any lice, nits. We're going to feel for any bumps, lesions, any abrasions or scales in the scalp, and I don't feel anything. I don't see anything. No sort of lice, nits, nothing like that. His head feels nice and symmetrical, and no sort of bumps in the skull. Next, I'm going to look at his face just to make sure it's perfectly symmetrical. No droopiness in his eyes or his mouth. And then we're just going to feel on his temporomandibular joint, and we're going to feel for any tenderness. Any tenderness there? No? Okay. Then we're going to test the joint, so go ahead and open your mouth for me. Perfect. And I don't hear any cracking. No tenderness there when you open it? No. Perfect. So no tenderness in his jaw, and now we're going to go to the eye portion. Okay, so this is the eye portion. The first thing I'm going to do is look at his eyes. I'm going to look at the color. They're both perfectly blue, perfectly symmetrical. No droopiness in either eye or the other. No sort of strabismus or nystagmus. So his eyes aren't moving around. His eyes aren't crossed. His conjunctiva is nice and pink. If I look at his eyes like this, nice and pink, you're nice and hydrated. And then I'm also going to look at his corneas that are nice and pink, and his sclera is nice and white, so no yellowing or indication of any jaundice or anything. So the next thing I'm going to look at is to see if his pupils are reactive to light. So you're going to look at my pen light here, and I'm going to take it away. You don't have to follow it. And then we're just going to bring it back. Perfect. And the same with this eye over here. And his pupil gets smaller to light, so that means his pupils are nice and reactive. Next, I'm going to put the pen right in front of his eyes, and you're just going to follow it close. Perfect. And I'm going to take it away and do it again. And his eyes cross whenever I bring the pen light near, so his eyes are moving just as they're supposed to. Next, I'm going to test for the extraocular movements. So you're going to look at my pen here. We're going to do the 6 cardinal fields of gaze. So we're going to follow it up, down, right, left, up, down, up, down. Perfect. And his eyes followed all 6 cardinal fields of gaze. Okay, so next we're going to test for pupillary accommodation. So I'm going to hold this pen about 4 to 6 inches in front of Blake's eyes. He's going to look at the pen. Then he's going to look at the Snellen chart that's right next to the camera there. So go ahead and look at it. Then look at the pen again. Look at it. And look at the pen again. And his eyes, his pupils constrict whenever he looks at the pen, and they dilate whenever he looks at the Snellen chart. Okay, and the last part of our eye assessment is the use of the Snellen chart. The Snellen chart that we have pictured next to our camera is smaller than the ones that are in the hospitals or in the doctor's offices. So Blake is going to test his vision in both of his eyes, and then he's going to cover his left and right eye separately and just read until he can't read the smallest letters. So Blake, if you want to start with the first line.
E.
The second line.
LT.
The third line.
FPH.
The fourth line.
OLCF.
The fifth line.
DHJBS.
And the sixth line.
EPTZO.
Okay, and that's 20/20 vision. Blake has had corrective eye surgery in the past, so sometimes 20/20 vision is a little bit hard for him, but he did get all the way down to 20/20. So if you want to go ahead and cover your left eye, okay, and go ahead and start at the top.
E.
Okay, second line.
LT.
The third line.
FPH.
The fourth line.
I don't know.
Okay, so he's got a little bit of troubled vision in this eye, so he got to 20/50. So he probably needs corrective lenses, but he has not gotten them. So go ahead and cover your right eye. Okay, go with the first line.
E.
The second line.
LT.
The third line.
FPH.
The fourth line.
OLCF.
The fifth line.
DHJBS.
Okay, and the sixth line.
EPTZO.
Okay, so he's got 20/20 vision in this eye and 20/50 in the other eye, and that was the eye he had corrective surgery whenever. Okay, so now we're on to the ear portion of the assessment. So the first thing I'm going to do is I'm just going to look at Blake's ear. I'm going to palpate the trachea and the mastoid for any swelling or tenderness. Any swelling or tenderness here?
No.
No, okay. No redness, no lesions, nothing like that. Come around on this side, palpate the mastoid back here. Any tenderness?
No.
Any tenderness here, palpating the trachea?
No.
Okay, no redness, swelling, or lesions there. Next, we're going to test Blake's hearing. So Blake is going to occlude one ear. Go ahead and occlude one ear, okay. And then I'm going to stand on this side. I'm going to whisper a 2-syllable word. Blake's going to repeat it back to me. 7.
7.
Okay, and I'm going to come around on this side. And I'm also going to whisper a 2-syllable word.
11.
Okay, and he can repeat both of those words back to me, so he's got good hearing in both ears. Next, we're going to use the otoscope, and we're going to look in Blake's ears. We'll pull this up and back. Notice some cerumen. The tympanic membrane is nice and pearly gray. Cone of light reflects at about the 7 o'clock hour, so that's perfect. Everything looks normal, no redness. Tympanic membrane is nice and visible. No swelling, discharge, nothing like that. So I'm going to come around the other side, and we're going to look the same way. Tympanic membrane is nice and visible, just some cerumen. Cone of light reflects at about the 5 o'clock hour. Nice and pearly gray, no swelling, drainage, or anything in there. So both of his tympanic membranes look good. The inside of his ears look great, and everything looks perfect with this ear health assessment. Okay, for the last part of the hearing test, we're going to do the Weber test. So this is just a fork I have. I don't have a tuning fork, but with a tuning fork, I would activate it like on my knee or my elbow, and then I will place it on Blake's head like this, and then he's going to tell me if he hears it better in his left ear, his right ear, or if it's the same in both ears.
Same in both ears.
Okay, and he hears the same in both ears, so that means he's got no conductive hearing loss. Okay, and then the last part of our hearing test is the Renee test. So again, I would activate the tuning fork on my knee or my elbow, and then I would put it at the mastoid behind Blake's ear, and he's going to tell me whenever he doesn't hear the sound coming from the tuning fork anymore.
I don't hear it.
And then whenever he doesn't hear it, I'll move it to the front of his ear, and then you'll tell me if you hear it or if you don't hear it.
I hear it.
Okay, and then you'll tell me if you stop hearing it.
I don't hear it.
Okay, so then he stops hearing it, so that indicates that he doesn't have any sensorineural hearing loss. Okay, now we're on to the nasal portion of the assessment. So the first thing I'm going to do is I'm going to look at Blake's nose, and I'm going to palpate just for any tenderness to make sure there's no swelling, tenderness, anything there.
Mm-mm.
No? Okay. The cartilage feels nice and flexible, the bone feels nice and straight, no sort of curvature to the nasal bone. And then I'm going to palpate his frontal and maxillary sinus. So you're just going to tell me if there's any tenderness here.
No.
Okay, any tenderness up here?
No.
Okay, and I don't feel anything out of the ordinary there. And then I'm going to test his nasal patency. So go ahead and occlude one of your nostrils for me. Okay, and take a deep breath. Okay, and do your other one. Deep breath. Okay, so Blake has a little sinus infection, so you can tell that the right nasal was a little bit congested. And next we're going to use the otoscope, and I'm just going to look in his nose. So go ahead and touch your head up for me. Okay, and I see his nasal sinus is pretty red with a little bit of watery drainage. Okay, and then same on the right side, just pretty red with some watery drainage and a little bit of looks like a little bit of swelling in there. So he has just like a little bit of a sinus infection going on. And then next I'm going to take this off, and we're going to look at his transillumination of the sinuses. So we're going to put this right above his eyebrow here, just to visualize the sinus up here. Perfect. And the same thing up here. And then we're going to put the light right on his cheekbone. You're going to tilt your head back a little bit, open your mouth. And we can see just a little bit of light coming through on the roof of his mouth, and that indicates that there's some air in that nasal passageway that we can just see through. Go ahead and open up again. Perfect. And you can see that the light shines in there. So now we're on to the neck portion of the health assessment. So first I'm just going to look at Blake's neck just to see if it's nice and symmetrical, and it is. I don't notice any lesions, any bumps, any swelling. Do you notice any swelling, any tenderness? No, nothing like that. Perfect. So then now we're just going to look at his trachea. So go ahead and tilt your head up a little bit for me. And we see that his trachea is nice and midline. It's not deviated to one side or another. And then we'll look at his thyroid gland. So tilt your head up again and then swallow for me. And you can see that thyroid gland just moves up a little, up and down, and that's normal. And then now we're going to test his range of motion in his neck. So Blake, you're going to put your chin to your chest. Okay, lift it up again, and then put your head, your ear to your shoulder. Okay, and do it on the other side. Perfect, and then move your head in a circle. Perfect, and he's got great range of motion in his neck. Okay, now we're on the palpation portion of the neck exam. So I'm just going to feel on Blake's lymph nodes, starting all here at the back of his skull, going all the way behind his ear, going down the inferior jawline, and going down both sides of his neck, and to the middle of his clavicle. Any tenderness here?
No.
And I don't feel any protruding lymph nodes or anything like that. I don't feel any lymph nodes sticking out at all. And then next we're going to look at his trachea. We're just going to palpate a little bit, and his trachea is nice and midline. Again, not deviated to one side or anything. Next we're going to assess his thyroid gland. So I'm going to go behind Blake, and I'm going to put my hands both here. You're going to tilt your chin to your chest, and you're going to swallow. Perfect. And I can feel his thyroid gland moving up and down. So he's got a normal thyroid gland. And then we're going to go on the back of his neck here. We're going to feel on his cervical spine. It's nice and midline, no curvature, any tenderness here. No. And then the last thing we're going to do is just palpate his cervical muscles here. So we're going to palpate all the way down the back of his spine, and then kind of feel on these muscles here. Any tenderness here?
No.
No, perfect. All right, and then the last part of our health assessment is just going to be the throat. So I'm going to look at Blake's lips. They're nice and pink, no sort of cracked lips, no sort of dryness. They're nice and pink in color, and everything looks great with that. So then I'm just going to take a look at his mouth. I'm going to use the light just for some guidance here, so go ahead and open up for me. Perfect. The mucosa is nice and pink. His teeth are all intact. No sort of cavities noted. His gums, there's no retraction there. Everything looks great. Can you stick your tongue out for me? Go to the left side. Go to the right side. Perfect. I don't notice any ulcers or any lesions on his tongue. Go ahead and stick your tongue out for me. Then we're just going to look at the back of his throat. The hard palate is nice and pink and moist, and along with the soft palate, and the uvula is visible in the back. And then Blake had a tonsillectomy, so he doesn't have any tonsils. But if he did, we would just grade those depending on how swollen they were. If there was any like white particles on the tonsils, anything like that, that would indicate a throat infection. So that is the entire health assessment, and thank you guys for watching.